What we found in Massachusetts is that the role of ADAP is to be the safety net, is to bridge the gaps where other payers are not able to help people, and that's the role it continues to play. It may look a little bit different than it has in the past in terms of it's not only the full coverage of the full cost of drugs for people, but that doesn't mean it's not what it should be. I think it still plays the role that it was meant to play, which is to be there for people who have access to nothing else at that given time.
Healthcare in general, there'll always be gaps. So I think that Ryan White will still need to fill them. ADAP will still need to fill, obviously a part of that, filling that. But I think we're going to have to broaden our scope a bit in what we look at outside of medications in the bigger circle of care scenario. That we're going to be not that we're not a critical part now, because we are, but we have to look beyond being medication specific.
I see the future of ADAP in a reformed healthcare system as still being critical for people living with HIV and AIDS, particularly because right now there's so many questions about health reform and its implementation at the national level and in certain states. You know, it's going to vary from state to state. But I don't see the need going away. There may be a shifting of the need. It may move more towards helping people through the insurance exchanges. But there's clearly going to be a need, at least for the next 5 to 10 years.
I see our ADAP as purchasing health insurance. We're not currently in that market because of the structure of our ADAP. We currently use the Bureau for Medical Services, Medicaid, to pay for our drugs, and Medicaid doesn't buy insurance, so we're not currently able to do that. But I see us as restructuring totally by 2014, and that we will be purchasing insurance and then doing all the wraparound of deductibles, copays, just as we did with Medicare Part D. So Medicaid will continue to play a very important role for the state of West Virginia, but the bulk of our dollars will go out for paying premiums.
Right now we're looking at the medical side a little more, which is a struggle based on where our funding sits currently. Because, so that being said, we're wrapping around everywhere we can with the insurance scenario. So any kind of insurance, you know, Medicare Part D and our pre-existing insurance programs, we're wrapping around everywhere we can, and successfully have been doing that for a number of years.
I think the future of ADAP is evolving, and it has been evolving. It's never been really static. Ever since I began working in 2000, there have been changes. Changes to Medicare that's impacted ADAP, changes to Medicaid that's impacted ADAP. And right now the biggest change on the horizon is obviously the Affordable Care Act and how it will be implemented, you know, in the nation, and how that implementation will affect ADAP.
We have a lot of landscape discussion with our clients we serve that hopefully give them a broader perspective beyond today. Obviously they call us and say, hey, you know, we have this need today, and we try to make the conversation more about looking down the road and what the landscape looks like, whether it's an interaction with insurance that may become available to them, and or, you know, what things, thinking beyond today so that they're able to plan for future and make the best decisions for them. There's not a lot of folks or companies, really, other people that they may come in contact with that are doing the same thing, so we really feel it's not only meeting the need today, but providing them with tools to look ahead.
What a lot of people forget is that treatment is prevention, and that when you have universal access to care, which ADAP is a part of that universal access, you actually see your cases of HIV going down over time, because you see a lowering of the community viral load, and therefore treatment is actually prevention in that case. So I think it's important to remember those things when we think about the future of ADAP. I think one thing I can say for sure is that ADAP is still going to be needed.
We've been talking about that a lot at this ADAP TA meeting, and no one has all of the answers yet, still many more questions than answers, but the overriding theme that I'm getting from all these discussions is that ADAP is not going anywhere. The need is still going to be there.